This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app. Today's podcast is on new onset neck pain. So you may be sitting there and just stretch your neck. You may be exercising. You may be in a car accident. You may wake up with it, but all of a sudden your neck is killing you and it locks up. A lot of times your neck will freeze up. You have to move your whole torso. Your whole chest moves in one motion with your head as kind of like a robot because you don't want to move your neck because it hurts every time you do. And everything's locked up. Your muscles go into spasm and your neck is killing you. It's the worst thing in the world. It's hard to go to work and act like you're normal and talk to people and nod your head when they're talking and everything else because you can't even move your neck. It affects any job you do, much less hanging out with your kids or trying to be a parent or anything else. So what we'll talk about today is what are the causes of the neck pain? What are things you need to worry about, potential red flags, what could be bad issues that you got to be concerned about? What is the treatment? And then ultimately, how do you prevent it from happening again? So we'll start with the diagnosis. Most likely when people get a flare-up of neck pain or back pain, the most typical thing, if it's coming from your spine, is an annular tear in the disc. So there's a disc in the front. You have 7 cervical discs. You have 5 lumbar, 12 thoracic. And the discs are the main workhorse of the spine. Most of all the loading and motion and rotation occurs through the disc. There's 2 parts of the disc. The outer part of the disc is the annulus. It's like a woven basket. It provides all the stability. The center part is the nucleus. It's more shock absorbing and watery and absorbs more of the stress. So the annulus is the outer part, that woven basket providing the stability, and it's richly innervated, which means there's a lot of nerves going in it, that if you get a tear in the annulus, it hurts like hell. It's like partially tearing your Achilles or your hamstring or any soft tissue in your body, and you get a tear in this woven basket, the annulus, and it hurts. It releases acidic chemicals. These acidic chemicals come out of the disc and irritate the nerves, causes more pain, and basically the muscles will lock down to try and stop any stress on the annulus because your body doesn't want you to get it worse. If you keep doing whatever you're doing and you rotate and pick up heavy things and whip your neck around, you can make the tear bigger, which can develop into a herniation, which is a disc herniation. The herniated disc can then hit a nerve, cause pain or weakness or numbness down your arm, or hit your spinal cord, which can throw your balance off, affect bowel and bladder function. So your body has gotten a tear in the disc, in the annulus, this annular tear, and it doesn't want to make it worse. So all the muscles lock down, go into spasm to stop you from moving so that you don't make it worse. You don't get a herniation. You don't tear off a piece of disc that then causes neurologic issues and worse problems, which may need to have surgery. So the number one cause of most flare-ups of neck pain is an annular tear in the disc. And what it means is a big warning sign. Stop whatever you're doing. Just take it easy for a couple days. Let this tear in the disc heal. It'll actually scar in and heal, just like partially tearing your muscle or your tendon. It can take a couple days to scar in and heal, and then the pain can settle down, and then you're less vulnerable. Then you can slowly get back to your life. So an annular tear is the number one reason for acute flare-ups of neck pain. Number 2 would be a facet joint sprain. For every disc in the front, you've got 2 facet joints in the back, just like a knuckle in your finger, basically a joint where motion occurs, and you can get a sprain of the facet joint. And that can be from a rotation and extension, like leaning your head back and twisting your neck, especially if you get hit in the head, can cause a sprain of that facet joint. And then the third reason for the pain is a whiplash injury, which is basically a muscle strain. And that typically happens from like a car accident where your head whips back and forth and it can strain the muscles. So the 3 reasons you can get neck pain are an annular tear in the disc. That's number 1 and the most common. Number 2 is the facet joint sprain. Number 3 is the whiplash or the muscle strain. Now, fortunately, the treatment for all 3 of these is basically the same. Basically, take it easy for a couple days, let them cool off and heal. You can take anti-inflammatories, take some medication, and then start doing some physical therapy, rehab exercises. Now, the things we worry about, which we call the red flags, are if you get pain going down your arm, and that's when a nerve can get irritated. So that disc, if it tore and you got a herniated piece of disc pushing on the nerve, then the pain can go down the arm. And that's when we worry more because it means the injury is more significant, more risky for nerve damage, and more likely to potentially have to have surgery. So if you get pain weakness or numbness going down the arm, it's more indicative of a nerve being irritated, makes it a little more risky, makes us want to be a little more cautious. The other thing to worry about is if the disc herniation goes straight back into your spinal canal and hits your spinal cord, then it can actually cause paralysis. It can cause numbness and tingling and weakness into both arms. And here's a general guideline. If it goes down one arm, well, then it's usually a nerve being irritated down that one arm. If it goes down both arms, it's more serious, more likely to be a spinal cord injury, which is right in the middle, and that's why it affects both arms. Especially we take care of a lot of football players. That's when we really worry about football injuries. You get hit in the head or hit somebody with your head. If you get numbness, weakness, tingling, shocks down both arms, then it may be that you've injured your spinal cord. It's more risky. Same thing in everybody. It goes down both arms, we're more worried about your spinal cord. If it goes down one arm, which is called a burner or stinger in a football player, well, then it's more likely just a single nerve root. Still a concern, but not as risky as your spinal cord. So the other things to worry about we call red flags is do you have a balance disturbance? If all of a sudden your balance is off and you can't do that heel to toe walk like the police officers make people do on Cops, the TV show, if you can't do that heel to toe walk, your spinal cord may be affected by a disc herniation, and that's throwing your balance off. And that's going to make us more concerned, more likely to get an MRI and see exactly what's going on. And then the last thing to worry about is bowel and bladder disturbance. If you're losing control of your urine and your feces and going pee and poo in your pants, I mean, obviously be concerned, let your doctor know, and be more indicative of your spinal cord potentially being affected and needs to be worked up a lot faster. Go to the emergency room, basically, if it's anything really significant. So now let's move on to the treatment. Number one treatment, like anything in life, is you've hurt yourself. What should you do first? Well, take it easy. Take a couple days off. And that's one of the hardest things about our lifestyle and our society is nobody has time to take a day or two off. Even my kids, they got to go be at flag football, skateboarding. They can't take a week off. They got stuff to do, people depending on them. Well, the human body sometimes just needs time to heal. Give yourself a couple days. Don't go to your spin class. Don't go hang out with your friends on the boat and go water skiing. Take a couple days off. Let your body heal. Be smart. We take care of a lot of athletes, and the hardest thing about treating athletes is they don't have 2 to 3 days to take off. They got to play in the playoff game. They got to earn their money. They got to do their job. Their life is dependent on it. And that's the hardest thing is a lot of times the human body just needs time. Give it time to heal. Give it a break. Generally, your body has everything it needs to heal itself. It will heal itself for the most part, so long as you give it time. And that's like 80 to 90% of conditions. Acute flare-up of pain, you're in a lot of pain, give it time, it'll settle down and heal. So rest. Give your body a break, let it heal. Like I said, you may have a tear in the disc. You don't want it to get worse. Don't strain it. Don't do anything that causes pain. The good news is you can let pain be your guide. If you do things that are continuing to provoke pain, well, stop doing them. And that's kind of the easy answer, but it still rings true. It's been that way for 1,000 years. If it hurts, don't do it. Give your body time to heal. Then the second component of the treatment is we want to knock out the inflammation. So you want to take anti-inflammatories, Advil, Aleve, Naproxen. There's a risk of an ulcer in your stomach and causing issues with your kidneys with long-term use, so always check with your doctor. But basically, we want to get rid of the inflammation with anti-inflammatories. The strongest anti-inflammatory is prednisone. It's a steroidal anti-inflammatory, and it works better than anything. So we do a Medrol dose pack or a course of prednisone to knock out the inflammation. But you don't want to take these hardcore prednisone, anti-inflammatory steroids and then run back and go do everything you were doing that hurt yourself, because you can mask the pain and just make it worse. So rest, take the anti-inflammatories or the prednisone, knock out your inflammation. And there's obviously a risk with prednisone. So anything I recommend in this podcast, check with your doctor. That is the obvious disclaimer. But basically you want to knock out the inflammation. Then you want to start moving again. You don't want to do anything to provoke the pain, but you also don't want to get too stiff. So we typically do not treat people with neck braces. Now, if your neck's in a lot of pain, wearing a soft collar or neck brace for a couple days is totally reasonable and fine. But you don't want to be stuck with it, because then you can get stiffness in your neck. So you still want to take it off and gently move your neck and start circulating the blood, relaxing the muscles, and get the motion going again. And once your pain is settled down enough, I generally recommend getting a massage where you can work on the muscles around the area, because all your muscles in your scapula, your shoulder blade, your lower back will all tighten up as well, and you want to release some of that muscle tension that's built up. Having a good masseuse can be very effective, but you don't want the masseuse to twist your neck or give you a Thai massage where they grab your head and crack your neck or anything weird, because you don't want to make it worse. And so, but having your body in a neutral position, face down with your head supported in a neutral position, you can get a massage to relax the muscles, but go real slow. Make sure they don't do anything worse or make it worse. Chiropractic treatments can be very effective for acute neck pain. Same kind of thing, though. I don't recommend any cracking in the neck or anything violent. Basically, neck in neutral, release the soft tissues is the goal. And then ultimately, once the pain settles down, we get people into physical therapy where they're doing postural strengthening exercises to put their head in a better position and to support their head better. Your neck has to carry the weight of your head around all day. Well, you got to work on the muscles to keep your head in a better position so the stress goes on the muscles, not on your spine, not on the discs and the facet joints, but keep it on the muscles. And that's where physical therapy is so effective. And so then if that doesn't work and somebody's still been in pain for a week or two and they're not making any progress, well, that's typically when we'll get an MRI. We'll see structurally exactly what's going on. Is there a disc herniation? Is there something really significant to worry about? And then ultimately, if they're not getting better and we've got the MRI, we've made a diagnosis, what is the problem? Then doing an epidural is a reasonable option. And an epidural is basically the same prednisone that people take by mouth. We just inject it in the neck around the area of the pathology, and it can be more effective. It can be more effective, it can work better, and it can last longer because it's concentrated in that area, and it may last for a month or two, which allows the inflammation to settle down, which allows somebody to get into physical therapy and ultimately get back to their life. Now, so we've gone over the diagnosis and the red flag things to worry about, the treatments, and then basically, how are you going to prevent this from happening again? And basically, it's a combination of increase your muscle strength of your core muscles and of your chest out postural muscles to put your head in a better position to keep the stress on the muscles. And the chest out posture is basically stick your chest out, let your shoulders fall back, and which brings your head back over the rest of your body. The problem with sitting all day slumped forward is your head effectively weighs more. Every inch you get away from the center of axis of rotation magnifies the weight of the head exponentially, and its torque basically weighs more. So if you stick your chest out and bring your head back over the rest of your body, your head weighs less, and it decreases the stress on your spine. So the chest out posture exercises, basically in our app called The Back Doctor, which is free in the App Store, it's got all the exercises. The two main ones we generally recommend are the dead bug, which is the back exercise program, and the standing dead bug, which is in the neck program. And if you just do some of those basic exercises every day, you can take 2 to 3 minutes every day, fire off some exercises where you wake the muscles up, get them working, and keep them strong. It can help prevent future injuries and future neck pain. It's the best thing we have. We can't prevent aging. We can't prevent wear and tear on the disc and trauma that occurs. What we can do is work on the muscles, keep the muscles strong to keep the stress off the spine. So back to prevention. Number one part is strengthen the muscles, which we just talked about. Number two part is decrease stress that can build up abnormally in the muscles. How do you decrease the stress? Number one is cardiovascular exercise. Get your heart rate up, break a sweat for 20 to 30 minutes, 3 to 5 times a week. Nothing hardcore, just enough to circulate your blood, washes out lactic acid that builds up in the stress and in the muscles. It'll release endorphins. It'll make you feel better. It'll decrease muscle tension, decrease mental and physical stress. Cardiovascular exercise is the greatest thing in the world to prevent having flare-ups of neck pain in the future, so long as the exercise isn't causing pain. So I was doing triathlons and biking where I was, extending my neck and trying to keep up with the guy in front of me so I could draft off him. I kept hurting my neck. Well, I stopped biking. Now I do an elliptical. I may do a recumbent bike. I swim with a mask and a snorkel so I don't have to turn my head. I run twice a week maximum. But I do some form of cardio where I'm going to break a sweat, circulate my blood, not stress my neck, and decrease the stress that can build up in the neck muscles. Number two, what you can do to decrease stress: meditate. Take 15 minutes whenever you can during the day. lay in a comfortable spot, listen to a meditation. I listen to Hypnosis Downloads Energy Booster. Greatest thing I've ever owned in my life. Cost me $10. I've listened to it 1,000 times. But find something you can do to relax and lose consciousness for a moment where you drift off. You start to dream. Maybe you just have one dream image where you've lost touch with reality, even for a second. That can help break the mental and physical tension that builds up in your muscles throughout the day. All your body needs is a second. Just give it a second and a break. And meditating or hypnosis or any form you can do where you just escape for a second can be very helpful. And then getting a massage. I try and get a massage at least once a week or once every other week to decrease some of the muscle tension that can build up throughout the week. And so that combination of decrease the stress that builds up in the muscles through cardiovascular exercise, meditating, getting a massage, just decreasing the stress in your life in general. And then the second component is build up the muscle strength. Do the dead bug, do the standing dead bug, which is on the Back Doctor app. Do those every day for 2 to 3 minutes even. Fire the muscles. Can help prevent getting flare-ups of pain in the future. So to review, what we talked about was neck pain showing up, severe neck pain. What is it? The diagnosis, usually it's a tear in the disc, maybe a facet joint sprain, maybe a whiplash injury. What are the things to worry about? You worry about arm pain or weakness or numbness down one arm or two arms, any bowel or bladder disturbance, any balance disturbance. Those are the red flags. Then the third thing is the treatment. You want to rest. You want to get rid of the inflammation with oral medications that are safe. Get a massage. See a chiropractor. Get some soft tissue releases. Then get into physical therapy and do the muscle strengthening. So I hope that's been helpful. If you have any questions, please come see us at watkinsspine.com and reach out anytime.